March 22nd, 2010.
Just on my personal is what I remember.
Oh, okay. So I'm amazed. March 22nd, 2010 could be a day that maybe will live in infamy or live in history because it's all going to affect every one of you. Every one of you. March 22nd, 2010. I was awake March 22nd, 2010 at 12:10 a.m. And why was I awake March 22nd, 2010, 12:10 a.m.? Oh, we got someone who said something. What? That's when the Affordable Care Act was passed by Congress. Okay, so you know it's very interesting. March 22nd, 2010. I was actually in Washington D.C. in my hotel room, and I'm watching this vote go down, and all the history of how that act was passed. Many people don't remember anymore, and there are many things that happened on March 22nd, 2010, because in fact, that gave birth to the Tea Party as well. So some people don't think about that relative to just what health care legislation all meant. The reason I say that is because you guys are actually very much in the middle of history, because you're the real generation of physicians who's going to see how March 22nd, 2010 lives in your daily lives and in the care of your patients. And I use that because I think you have to think about yourself as a very part of this very critical part of our American history and how we think about healthcare. Now, the other thing that I wanted to share with you is I have a historical document. Okay, what is this historical document? It's a sheet that I wrote for my notes to your predecessors. The first year that Gary invited me to come to speak to the AT Still School of Osteopathy. It was about 5 or 6 years ago. But I kept these notes, Gary, because then I don't have to keep on rethinking about what I want to say. But the thing is, this was written 5 or 6 years ago, and there was nothing about the Affordable Care Act. And it is a totally different situation right now. However, there is something in this historical document that I think is still very relevant to where you are at in your career and what you think about. Okay, so it is about the constancy of certain things in terms of how we reflect as being healers, but at the same time having to force ourselves into the contemporary issues with regards to health care legislation. And where were you 6 years ago? I don't know where you were, college, high school even. It is an extraordinary time in terms of when things happen really quickly. Now I want you, this is where we really start going around the audience, asking you a little bit. Something that I really am confident that you will remember. Where were you and how did you feel when you got accepted into the school of osteopathy?
PA or dentistry or?
PA or dentistry as well. All the professional schools that are represented here. I'm really interested because this is your personal history. And I'm going to go around here and I'm going to ask someone, tell me how you felt the day you got that letter of acceptance and what it meant to you. So I'll make it easy. So I'm a volunteer here who wants to share with your class how you felt that very first day that you got there. Oh, okay, great. And can you share with me your name and phone number for your class?
Yeah, so my name is Adam Leger. I got accepted to the PA program here. Thank you. And there was like this huge weight had gotten lifted off of not only me, but my family too. And my son was so excited he stripped down naked and jumped in the pool. He's 5, he's 6 now, but so it was a great relief. And it was really good, really good.
That's great. I'm glad your son wasn't 16 or something. And thanks for sharing that story. Yeah, we're going to share that with your family, and it was a great weight off your shoulder. Tell me about the weight. What was the weight about?
I knew like I needed to get on with my life, and I needed to do something that could establish, some responsibility, and it was my second time to apply, and so I had that pressure on, and so I was like, okay, I finally have gotten myself into more trouble now.
A great sense of accomplishment. Congratulations. How about someone on this side? I want to hear, I can tell you my own story about the day I heard that I got accepted to medical school, and I have to say, like some of us, I had rejections as well. That's part of the kind of exaltation is to get accepted after you've been rejected, right? So, how about someone over here? Can you tell me what you felt on the day? Oh, okay, I got scared of it. What's your name? And can you tell me how you felt the day you got accepted?
I'm Michelle. I felt awesome because this was my third time applying, so I was really excited, and I didn't have to go back and retake all my prereqs, and yeah, it's basically awesome.
So you spelled R-O-L-A-I-D-S, right? You know what that means? Relief. Okay. Relays. That's a code commercial. Relief. It's a big deal. How about someone over here? Okay, let me get you between your bites of pizza.
Oh, you wanted me?
What's your name?
My name's Erica.
Erica?
Yes.
How did you feel your first day?
My first day of class?
No, the first day. When you first heard that you got accepted into, was it PA or dental?
Yeah, PA. Yes, PA. I was actually sleeping on the couch, and because I hadn't heard from the school yet, so I was a little depressed because it had only been like 2 days. My son runs in, Mom, they're leaving a message on the phone, you got it! And so I was so excited. So we all just went and celebrated and texted, the PA that I shadowed and all the people that helped me get there. So.
Did your son strip naked too?
He was not. He was 10, so I hope not.
Great story, thank you. So it's really it's kind of a high, isn't it?
Oh.
It's a high. And I want to learn a little bit more where the high comes from. Where's the high? Where do you expect it? What's the high about?
The excitement.
The
of
excitement?
Starting something new, I think.
Starting something new? How about, what's it about your whole process of applying, was it PA or dental or PAs? So you probably wrote a really nice essay about getting into PA school, right? And what you wanted out of being a physician's assistant. So how did that message translate to you on the day you got accepted?
I think mine was just more about starting a new chapter in my life. I mean, like I had been in the medical field prior, and just starting something new and different.
Okay, great, thank you. I'm gonna try one more. Let's try the middle, because I didn't get the middle. This is the only way you can keep you guys going after you get your postprandial somnolence, what they call it, food coma. But I know a lady that's expecting is not gonna have food coma, right? So why don't you tell me how you felt the first day that when you heard that you got accepted?
Well, this was back in 1998,
Oh, okay.
so it's been a little while.
12 years to matriculate. Okay.
Yes. It took a while, but I am actually not a student here. But I do remember. I do remember being just over the moon. It was my entire world, and it was just opening up all the doors for the future for me.
I apologize. So you're faculty here.
Yes.
And went to school.
In the PA program.
Oh, great. And you're a practicing physician assistant as well.
Well, I work here full time,
Okay.
so I'm not practicing clinically at the moment. But if I had more hours in the week, I'm sure that I would.
Okay. Great. Thank you. I guess that wasn't fair. She's not really a student. Well, I have to tell you, thank you for sharing your stories. And the reason I do that is because here you are in the midst of a very stressful semester, right? And I don't know what you're learning right now, PepSiCo or GFR or whatever. It is extremely stressful. And it is sometimes, I don't know, I think AT still is unique, but maybe not so unique in that in the thralls of this kind of curriculum, we have lost sometimes what it felt to get that layer of acceptance. And what it really meant for you to think about being a healing professional you know? And this is really what my message is to you. What does it mean to be a healing professional? And I have to tell you, I'll share my story. I got accepted into this 5-year program that Gary mentioned. It was to join UCSF Berkeley medical program. Have any of you have heard of it? It's a 5-year program. I was already undergrad at Berkeley. And I don't know after you know what you did, but I started to look at the thickness of the envelopes that I would get from the mail, right? In terms of a thick piece was good news and a thin piece was not generally so good. But on this occasion, I did not get a phone call. And I think today this would probably not be the right thing to do, politically correct thing to do, or the ethical thing to do. But the school that accepted me actually called my home phone. There were no cell phones back then. And spoke to my father and said, you know, is Winston Wong at home? He said, no, he's not here. He's at school. And he said, well, just want to tell you, Mr. Wong, your son got accepted into school. I didn't come home until a long evening, I think maybe about, well, it wasn't that long. I think he came home about 6 p.m. And my father, with great anticipation, I knew something was wrong, you know. And he says, Winston, we got a phone call. And he said, and this is really pretty bad, but I'll tell you. He says, did you get a girl in trouble? And I said, no, Dad. And then he says, no, you got accepted to medical school. And I literally felt like I was walking on a cloud for the next 24 hours. I had another obligation that I had to go to that evening, but the whole thing in my mind was, I'm going to be a doctor, and it will change the rest of my life. So when you got accepted, I think you probably felt the same way. You thought about how it would change the rest of your life. And now you're in the middle of this first year of curriculum, and you say, did I make a mistake? Is this what I really bargained for? What does it mean to be a healing professional? Now, when you think about what it means to be a physician assistant, a physician, a dentist, are there other professions here? Did I
Raise your hand if so.
So, what, you know, I always think about what does it mean to be a healing professional that is uniquely different? Okay, now you think about it. You go into a room, and people will tell you things that they will not tell anyone. There are things that they won't even tell themselves, but they will tell you because you have this badge or this white coat. And it is a very humbling experience to have a relationship with a patient when you're asked to really listen to them. Now, when you're asked to listen to a patient, let me ask you, what do you think people actually come to see you for? Why do they come to see a healing professional? Get to the core. What do you think? Why do you think people come? Why would they come to see you?
To solve a problem.
To solve a problem.
Pain they're feeling.
Pain. So I think that's really important. Because when you get down to distill things, people will say, oh, they came to see about their lab results. They didn't really come to see about your results, right? They came to see you because, and you said, pain.
Pain or suffering.
Pain or suffering. And pain and suffering is both physical and emotional pain, right? So when you think about what you are as a health professional, how do you really relate to a person in pain? How do you think about the armamentarium that you will bring to the bedside? How will you address a person's pain? That's a tough question. I'd like to get your feedback.
I don't know. Kind of just listen to everything they say and try to address their problems. And I don't know.
Okay. No, I think that's a great. So one thing I really heard is you want to listen. You really want to listen to your patient. What else do people come to besides pain? Is there another reason that why do you think a person would come to see you besides pain?
They might just need someone to listen to.
They want say that about another?
They need someone to listen to as well.
They need someone to listen to them, okay? And why would they want someone to listen to them? I mean, you know, they're at home, right?
I don't know, maybe they just want to tell
Get to
someone
the
their story.
emotion. Get to the emotion as to why someone wants to listen to you. Okay, all right, that's fair. How about over here? Why do you think people want to be listened to?
They're worried.
They're worried. That's kind of one of the words I was looking for. People are worried, they're in pain. And by worried, we also say people are insecure in their situation. They're very vulnerable in a situation where they go see someone they don't know, and they try to seek answers, or they try to seek relief, and they try to seek assurance in the face of insecurity. Did you ever think about being a healing professional in that regard?
I think we all kind of think about that
Yeah.
sometime. Yeah.
Have any of you been patients? Now I should expect 100% of you to raise your hand, right? So when you think about when you go see your physician, your PA, your dentist, when it comes down to it, you're not saying, oh, I want to see how my dermatitis should be treated, or I have headaches, or, you know, I'm seeking contraception. It is about security, it's about fear, it's about pain, right? And when you think about the skills that you are learning, what are the skills that you are learning that are going to enable you to address these issues? That's what I want you to really reflect on. Now, when you think about it, being a healing professional is a very unique situation because we actually we're required to come up with certain skills that are a combination of different skills. Now think about different professions. What does a healing professional have to encapsulate that's like other professions? You have any guesses? Any thinking? What other professions do the same things as physicians or healing professionals?
I guess counselors in a way, like marital counselors, just life counselors.
Yeah. So counselors, psychiatrists are kind of physicians, right? I hope they are. Yeah, I think there's an aspect of what I try to think of is there's a part of us that's actually like clergy. Because we try to have the situation where people open up to us and they feel that they're not going to be judged, right? And when you speak to clergy or whatever faith or whatever counselor that you might seek, you're just trying, as our colleague back there was saying, trying to find someone to listen to is therapeutic in that respect. Now, having said that, is it good enough to be a listener or to be a clergy as a physician or a physician assistant or a dentist? What's different about it? I heard something back here.
You need to provide answers. You need to help them feel like they're getting what they wanted out of it.
Yeah, so there's a technical aspect of it, right? And so I think about the other part of being a physician is this technical aspect. And you think about these really tough questions. Sometimes they are not really clear. What other profession does that? And it's very interesting. I actually think it's sometimes being an attorney, being in law. Because you seek help from the legal profession because it is so complicated. And because you don't know how to navigate through this very complex set of legal mandates and regulations. So there's an aspect of you being almost like an attorney. You have to spend several years learning what it is in terms of diagnosis, in terms of therapy, in terms of course of chronic disease. Now, we mentioned being an attorney, being a clergy person. What other aspect, especially in primary care, comes into play as being a professional? Can you think of something? Teacher. Why do you say teacher here? I can't reach quite that far, so you're gonna have to, I'll repeat what you said. Oh, maybe I can. So put you on the spot. Why do you say teacher?
Because we're supposed to educate our patients.
Okay, so we're supposed to educate her. You just sound skeptical. Okay, what's the other thing about the teacher that's really, I think you have something here, is beyond also just teaching a patient. What is it about it being a teacher that's very similar to being a primary care physician? Okay, I stumped him. Okay. No, this is not a Jeopardy question. And there's no, okay. I think teachers are a great aspect of it. I always think of who do you see on a regular basis over the course of your daily routine, like you go see on a monthly basis. Who do you see on a monthly basis that you don't know as part of your family? Or on a quarterly basis for some of us. You go see a dentist every month? That was a dentist. Maybe a dental hygienist, but okay. I just saw mine a few weeks ago. It's not a therapist either. Kind of a therapist. I think the other profession that we don't think about is the person who cuts your hair. Think about it. Right? You know, so this hairstyle, oh, well. You got the sideburns. No, think about it. In terms of the periodicity and the follow-up discussions. Now, I think most of you actually develop a routine. You have a hair stylist or a hair cutter that you start to feel comfortable with, right? And he or she always asks you, how things going, Jane? How things going, Bob? Kids doing okay? How's school? And there's something soothing about the fact that he or she kind of works on your head, gives you a nice shampoo, maybe gives you a head massage, but in the natural order of things, actually starts to build your life story. And I have to tell you, I had a hairstylist. She would even say, I know something's going on with you. I can't tell you what it is. I know something's going on with you. Because she had the benefit of seeing someone on a regular basis and building the story. Now, do you think of hairstylists or hair cutters as professions? Probably, maybe some of us do, maybe some of us don't. But I think it's really important that you think about the fact that you as a healer and as a provider, especially in primary care, you have this opportunity to create a relationship over time, right? And you have the technical expertise of an attorney. You have the confidence and the confidentiality of being someone in clergy. And you have the opportunity to see someone on a regular basis and create a relationship that is a very unique relationship. So the hairstylist is going to be your competitor. In a manner of speaking. But I actually think, and I think teacher is a great idea too. Although most of us haven't developed that side of our professional career so much. So think about this in terms of the first day, or the day that you got accepted into physician assistant school, into medical school, into dentistry. Don't think about the fact that you get to have a suffix after your name, but really what it meant in terms of combining these elements of being the hairstylist, the attorney, and the clergy person. Now, I want you to think now, fast forward to today, and what you've been trying to learn. How far is it close to this model of being a healthcare professional and embodying these elements? How far or how close are you being taught about what valuable components that we just had talked about? Listening, to addressing insecurity, to addressing pain, to addressing worry. What have you learned? And I have to say, I think, again, 18 still, people like Gary, they push against the tide. Because the tide of traditional medical school is this. We read a clinical story of a 15-year-old black male who presents with abdominal pain and blood in the stool, something like that. You don't mention that this is a 58-year-old African-American man who's part-time employed as a laborer who provides for his family of 4, who has a teenager that's having difficulty in school, who is also providing for his elderly mother, who is demented. Instead, we present these cases that are totally divorced from what really it is to be a professional. Instead, we start to use terms like the 50-year-old black male. And what does that do for us? It communicates that we need to divorce ourselves from what it means to be a healer. It means objectifying the condition and to think about how you would treat this 58-year-old male as you would a mouse in a lab. Because there's something very clinical, as we call it, very evidence-based, that needs to not clutter our mind with regards to understanding the dimensions of caring for people. And it is one of my pet peeves that if you ever write down in your note that you saw a 50-year-old male, what have you given up? You gave up a bit of your humanity. What's the difference between seeing a 58-year-old male, black male, from seeing a 58-year-old African-American man that is a part-time employee, that cares for a family of 4, that has a mother that he's also caring for that's going through dementia? We've lost our ability to really care. We've lost our ability to be the clergy person, to be the attorney, and to be the hairstylist. And we have failed in terms of our ability to really be caring for people. So when you got that letter, I hope you thought about what this really means in terms of what you want to be as a healthcare professional. Now, Gary told you a little bit about my background, but I'll tell you a little bit more. So I grew up in San Francisco. I was a San Francisco native. My parents, kind of an interesting family. I actually, for most of my childhood, I grew up in a grocery store, corner grocery store, because my mother ran a corner grocery store when there were such things. And my father was a federal employee as various things, including an interpreter, including a customs officer. So it was different and sane at the same time. Because one of the different aspects was I understood that my parents were immigrants. And immigrants were always treated differently. We weren't considered full Americans. In fact, it became so dominant inside our family that we would call Caucasians Americans and that we were not Americans, because it had been so internalized that you were not necessarily welcome into the mainstream of the United States. And I only mention this to you because I think there's a part of this whole aspect of feeling a little bit on the outside, which I think all of you could relate to in some way or another. You wouldn't have the same story as me, but you would have the feeling that sometimes you feel a little bit alienated. And that alienation is not necessarily a bad thing. It enables you to empathize with individuals that have that kind of challenge, that kind of story. And think about the fact, and I was talking to Gary about it, he's working, and his wife is working with some underserved kids in Phoenix. He told me a story that there are some kids in Phoenix who've never gone to the zoo. There are some kids in Phoenix who've never ridden as a passenger in a private car. there are some kids in Phoenix who've never gone on a campout. So when you think about how you relate to patients, think about your own story, think about what you want to be, and don't assume that everyone has had the same experience as yours. The other aspect of this, too, is when we think about diversity, we often think about diversity in terms of ethnicity, race, gender, sexual orientation, perhaps. But there's also diversity in terms of the people we see as patients. And I will tell you, there will be times when you see a patient that you're going to say, that patient smells. I can't stand to be in the same room with them. That patient is a malingerer. I cannot stand to be in that room with that person. That person is a drug seeker. I will not stand to be taking care of that patient. That patient is nuts, neurotic. I don't want to see that patient. It is part of your humanity to really ask yourself, to the point that our colleague made. People come in with pain, they come in with worry, they come in with insecurity. And if we can't be able to address that commonality of that emotion across people, that we kind of immediately have an impulse of saying, you're not like me, I don't like them, we have failed to be a truly health professional. A health professional means you need to elevate the standard of how to relate to people beyond what you automatically come in with, and the baggage that you come in with. If you see a person that you have no sense of where they're coming from, it demands that you take that opportunity and that responsibility even more so. And probably some of us have already had experiences taking care of patients that we found difficult. So I'm going to ask you right now, some of you in your clinical experience, either as a student or perhaps in the past, who are among the most difficult patients that you had to care for? You have one?
You mentioned it already, probably the drug seekers.
Yeah. And how did you process caring for the drug seeker?
And try to seek a better understanding of where they're coming from, why it is they're driven to ask you in the first place for that, and try to get around it.
Yeah. So the drug seeker, quote unquote, is a really difficult patient to care for. And we take a lot of shortcuts because we try to emotionally protect ourselves from getting pissed off with these folks, right? Isn't that true? Sure. And we try to do these walk-around avoidance or contracts or whatever. But there's something about how we think about the core reasons why people see a healer. Okay? And you need to command in your most difficult moments and pause for a second. Maybe take a deep breath and say, what do I have to do to compose myself and think about what it means to be a health professional? You have a very querying look here, or something that I get a sense that you want to share. Is that true?
Yeah.
No?
I'm a librarian. I'm not a guild.
Yeah, but I'm sure you've worked with people, even these really difficult students that come into your life.
And I think on Friday I was hearing PA faculty talking about drug seekers.
Yes.
And I think it's got to be hard. I've never been in that position, thankfully.
Yeah. Well, I would suggest, I use the term drug seeker just because people kind of know what that is, but it's important to say, again, is it a 58-year-old male? Is it a 58-year-old drug seeker? Or is it a 58-year-old disabled veteran that was traumatized in the Vietnam War that seeks relief because he cannot go to sleep every night? Right? What about another difficult patient? Ask this guy. I'll go back to her, okay?
You're in trouble. Probably the most difficult patient I have is a 96-year-old male, long time, worked on a farm, multiple underlying medical conditions, probably 10 or 15, probably 9 to 10 medications that he's on. And so he's just, when he gets sick, there's a lot of things to go through and consider. So it's challenging having to go through and factor in all the underlying medical conditions and then medications, but it's most, probably the most difficult, but then also probably the most rewarding.
Oh, I'm glad you said the last point because it was leading up to something maybe not so optimistic. Now, I'm sure you could tell me the story. It's a 96-year-old retired farmer who's worked the land for probably 60, 70 years, has seen a diminishing group of his social network, and has a lot of medical issues that he has to deal with. And at 96, most folks are saying, you know what, I can see the light at the end of the tunnel, right? And I caught you. Because the first line you said was a 96-year-old male, right? So I'm not trying to say that you're not developing, you don't have empathy for this patient, but it is about creating the stories. And part of what my story is to you, as being a health professional, how do you survive? How do you able to nurture yourself in the face of all these great pressures and stresses? You have to think about how you feel and how you relate to people, and how can you think about what you need to do as a health professional. And sometimes it's okay to think about it in a purely clinical nature in terms of this is a 26-year-old woman that suffers from manic depressive disease, that has difficulty maintaining her medications, blah, blah, blah. But other times it's about trying to understand the story. Because it's through the stories that will enable you to really thrive as a healthcare professional. And it's going to be very difficult when you see 20 patients a day and have no delusions that it will be difficult. Now, I think the other thing that I want to share with you, and maybe again that you can share with me, and this is also a survival technique. There was our colleague here that said part of being a health professional is teaching. Who are our greatest teachers? Who are our greatest teachers? I hear whispers. Someone declare it.
You're probably looking for parents.
Parents?
It depends on your family.
Who are our greatest teachers as healthcare professionals? Patients. Oh, okay, that came loud and clear. And it came from here, right? Oh. Is he a good friend of yours? Not even. No, he is a good friend of yours because he thinks that you have something valuable to share in terms of your perspective.
He's very wise.
Yeah, wise. Okay. Well, why are our patients our most important teachers?
Our patients, each patient is different, so every time we've got a new situation that we have to immerse ourselves in. And like you say, a lot of times health professionals have a difficult time connecting with patients, building pretty much the patient's story into their treatment. So every time you have a new patient, you pretty much get a new chance of trying that approach, and hopefully, that's what we.
Can you tell me something that you've learned from any of your people?
I had a short time as a CNA, and I worked in an Alzheimer's unit, dementia unit. And when I first started, I was kind of uncomfortable. I mean, the patients were a lot older, but I started to find common ground. A lot of them were World War II vets, and I love history, and so we'd start talking about those kind of things, and others. I just got married, and so some of the women I'd talk about, my wife or my family, and they just taught me a lot of interesting things. Even though a lot of them suffered from dementia and Alzheimer's, they still had a lot left to contribute.
It's interesting that the women taught you about marriage, not the guys. But thank you. No, I think that's really important. We have to think about our teachers as being patients. Because what did I ask you earlier? All of you have been good patients. And all of you have the chance to be teachers, to your healers. And I'll tell you my story with regards to being humbled by one of my patients and how generous my patients really are to me. Are your patients generous to you? And you'll all have one of these stories. So I took care of Mrs. Chan. My practice at a federally qualified health center is basically non-English speaking immigrants. Most of them are elderly. And I saw Mrs. Chan over several years. Mrs. Chan was a remarkable woman. She immigrated to the United States when she was 85 years old to join her family. And she joined her family because she says, I want to help with my grandchildren. And I don't know how many of you have walked the streets of Chinatown. You see these older ladies, and they have a little backpack with a little infant, and you know they're going around buying the groceries for that evening. She was one of those grandmas, remarkable woman. And then she even told me at one point, she said, well, I do a little bit of spare work. I said, what do you do? You're taking care of your grandchildren. I go to a sewing factory and I cut the loose threads from the garments. And I said, why do you do that? She says, well, you know, I make a couple dollars an hour, but I want to feel productive. And she did this at 85 years of age. She was a hero of mine. She didn't even go to elementary school because she was, you know, a child during the most turmoil times of when China was in civil war. But you remember these people because they're so special to you. And I have to say, when I take care of my patients, I always think of my patients as being my aunt or being my grandma, being my uncle. So it was one day when the emergency room called me and said, Mrs. Chan is in the emergency room right now because she has a GI bleed. And I said, darn it, I know I shouldn't have given her that ibuprofen for her arthritis. She's got some gastritis. And it was on a Saturday, and I had to worry about her all weekend. And I said, I have to sit up the gastroenterologist, get an endoscopy, and see what's up with her GI bleeding, upper GI bleeding. And I worried about her all weekend. That's part of the bargain that you make as a primary care physician. I couldn't just play with my kids freely that day. You know, I was thinking about it. Got the endoscopy on Monday. And the gastroenterologist calls me up and says, well, you know, and I very much anticipate, you know, you found the bleeder, you cauterized it, get her out of the hospital after transfusing her, get her back on her feet. But he said, she's got gastric lymphoma. It's inoperable. And, you know, it's like my whole sense of my relationship with this woman was totally disrupted. But the next morning, Tuesday morning, I have to go into the ICU, talk to her. And I see outside, she's got like 8 family members, all gathered around. As soon as I walked into that waiting room, they said, Dr. Wong, tell us what the specialist said. And I said, well, she's got a cancer, and it's inoperable. And I have to go in and tell her, because she just needs to start making plans now. And then they said to me, what do you think they told me? They told me, Dr. Wong, you can't tell her that. You can't tell her that. You can't tell her that she's got inoperable cancer. You tell her that, she might as well die tomorrow. She has no will to live at that point. And I respect that. And you know, culturally, this is all comes into play. We have our Western set of ethics taught in this school with regards to our obligation to tell the truth to patients. And we also have the obligation to be sensitive to our family and to our patients. And we have the obligation to be the best healthcare profession we can. What would you do? A few steps from the room. And I tell you, I didn't know what to do. I was a very relatively young physician, just starting off. I didn't know what to do. I was conflicted. As I mentioned, my parents were immigrants. I know about Chinese culture. I know about the Hippocratic Oath. I know about ethics. I went to public health school for all God's sake. I went into that room. I had no idea what to do. So Mrs. Chan, she looked up at me and she said, Dr. Wong, how are you doing? And I said, oh, I'm good, I'm good. And she said, well, how did the test come out? And then she said to me, well, I said to her, the tests were not that good. And then she looked at me and she says, you know, Dr. Wong, you've always been a good doctor to me. You've always cared for me. I really appreciate that. So don't worry. I'll be okay. And thank you for taking care of me. And I didn't need to say anything. She rescued me. I didn't take care of her. She took care of me. And it's those opportunities where our patients really teach us. And I still think about it a lot when I take care of my patients. Because these are the people that make your profession, your entry into this profession, so much of an honor. So much of an honor to be in a place where you can care for people. And I really don't want to see you become one of those docs that forgets that. It's so important. And it's so important when we talk about things like the Affordable Care Act, covered, insurance, expansion of Medicaid. It's not about that. It's about how you as a healthcare professional maintain that sense of, that feeling of when you first got that letter and why it was so important to you and what it means to be a health professional, what it means to bring these things together, what you are as an individual, and why you'll be a better person if you think about people like Mrs. Chan. So, I'll just end on that note. I just think it's really important for you, and I look to you guys as being the hope and the future of what it means to be a healing professional. So, thank you very much.